Gentlemen, let me ask you something personal. Are you waking up at 2 or 3 in the morning for no clear reason, staring at the ceiling, unable to get back to sleep? Do you notice that even after 7 or 8 hours in bed, you still feel heavy, foggy, and drained by mid-morning? Maybe your joints are stiffer than they used to be when you first stand up. Maybe your trips to the bathroom in the night have become a nightly routine you didn't ask for. And maybe, though you'd never say it out loud, your energy below the belt just isn't what it once was. If any of that sounds familiar, stay with me, because what I'm about to share isn't another supplement to order or a complicated protocol to follow. It's something you can make in your kitchen in under 3 minutes, starting tonight. And the science behind what it does to your body while you sleep is genuinely remarkable. And I'll tell you right now, number 5 on this list is the one that stops most of my patients cold when they hear it, because almost no one is talking about it. So don't leave early. I'm Dr. Amanda, a board-certified urologist with over 12 years of experience helping men over 60 reclaim their vitality, strength, and confidence. I've sat across from thousands of men in their 60s, their 70s, even their 80s, who came into my office convinced that what they were feeling was just aging, that it was normal, that there was nothing to be done. And time after time, I've shown them that simple, science-backed changes that cost almost nothing and require almost no effort, can restore what they thought was lost for good. What I'm sharing with you today is grounded in real physiology. Your body doesn't stop responding to good inputs just because you're older. It actually needs them more. And tonight is as good a time as any to start. Before we go any further, do me a quick favor. Hit that like button right now and drop a comment below telling me where you're watching from. I genuinely love hearing from men all over the world who are taking their health into their own hands. It takes you 2 seconds and it helps this video reach the men who need it most. All right, let's get into it. Here's something I want you to really sit with for a moment. Most men over 50 think poor sleep is just part of getting older. They accept it, they joke about it, they buy a better pillow. But what's actually happening during those lost hours of sleep is far more serious than most men realize, and it's quietly affecting everything from your testosterone to your heart to your sexual function. Here's problem 1. During deep sleep, specifically during slow wave and REM sleep, your body releases the majority of its daily testosterone. Not a little, the majority. Studies show that men who sleep fewer than 6 hours per night have significantly lower testosterone levels than those who sleep 7 to 9. If you're waking up repeatedly in the night, you are literally interrupting your body's hormone production cycle, night after night, year after year. Problem 2. While you sleep, your kidneys are supposed to slow down urine production so you can rest through the night. But after 50, the hormone that signals this slowdown, called antidiuretic hormone, becomes less effective. The result? You wake up to urinate 2, 3, sometimes 4 times a night. Every interruption pulls you out of deep sleep, and every missed hour of deep sleep accelerates hormonal decline, cognitive fog, and vascular aging. Problem 3. Your body does the vast majority of its cellular repair, anti-inflammatory work, and cardiovascular recovery while you sleep. Muscle is rebuilt. Blood vessels are restored. The immune system resets. When sleep is fragmented, even mildly, all of that maintenance gets skipped. Think of it like a factory that never gets to shut down for repairs. Eventually, the equipment starts failing in ways that show up as fatigue, reduced performance, and the slow diminishment that too many men accept as inevitable. It is not inevitable. And the drink I'm going to walk you through today directly addresses all 3 of these systems: hormonal, urinary, and cellular repair while you sleep. Let's count through the 7 reasons why. Base recipe: 1 cup warm water or warm tart cherry juice, unsweetened, plus 200 to 400 milligrams magnesium glycinate powder, plus optional, pinch of sea salt, squeeze of lemon, or small amount of raw honey. Tart cherries are one of the very few whole foods that contain measurable amounts of naturally occurring melatonin, the hormone that regulates your sleep-wake cycle. But beyond melatonin itself, tart cherry juice contains tryptophan and anthocyanins that inhibit the enzyme which breaks down tryptophan in your body. The result is that your brain has more raw material to produce its own melatonin, naturally and gradually, the way it was designed to. This is fundamentally different from taking a melatonin pill, which floods your system with a synthetic dose and often leaves men feeling groggy or dependent. There is a specific frustration that comes from lying in bed exhausted but unable to drift off, or waking at 3 a.m. with your mind racing and your body restless. Many men describe it as feeling betrayed by their own biology, like their body has forgotten how to do something it used to do effortlessly. When sleep begins to restore, when you start sinking into deep, uninterrupted rest again, it changes everything. Your mood lifts, your patience returns, your confidence comes back, because you are finally recovering. Practical. Use 4 to 8 ounces of 100% unsweetened tart cherry juice. Montmorency variety is the most studied. Warm it gently on the stove or in the microwave, but don't boil it. Drink it 30 to 45 minutes before bed. Do this consistently for at least 2 weeks before evaluating the results. Natural melatonin support builds gradually, not overnight. Magnesium is involved in over 300 enzymatic reactions in the human body. An estimate suggests that up to 70% of men over 50 are not getting adequate amounts from diet alone. At night, magnesium acts as a natural calcium channel blocker. It tells your smooth muscle tissue, the muscle that lines your blood vessels, your bladder, and your airways, to relax. This relaxation lowers blood pressure naturally, reduces nighttime leg cramps, calms an overactive bladder, and quiets the nervous system so the brain can transition into deeper stages of sleep. Magnesium deficiency has a distinct emotional signature, a low, persistent tension that never fully releases, an edginess, a body that feels like it's permanently braced for something. Men who restore their magnesium levels often describe the shift in remarkably similar terms. They say things like, "I didn't realize how wound up I was until I wasn't anymore." That release is what your body has been waiting for. Add 200 to 400 milligrams of magnesium glycinate powder to your warm tart cherry base. Glycinate is the form that absorbs best and is gentlest on the digestive system. Avoid magnesium oxide, which absorbs poorly and can cause loose stools. Start at 200 milligrams for the first week and increase to 400 milligrams in week 2. Most men notice deeper sleep and fewer nighttime awakenings within 7 to 10 days. I think of Robert, 68, a former high school football coach from Georgia. He came to me frustrated and frankly a little defeated. He said, "Dr. Amanda, I haven't slept through the night in 3 years. I wake up at least 3 times. My wife has moved to the guest room. I'm embarrassed and I'm exhausted." His testosterone was low. His blood pressure was creeping up, and he had the energy of a man 20 years older than he was. I introduced him to this tonic as one part of a broader sleep protocol. 3 weeks later, he came back and said, "I slept 6 hours straight on Tuesday. My wife noticed before I even told her." 4 weeks after that, his follow-up labs showed a measurable uptick in testosterone, because his body was finally getting the recovery time it needed to do its job. Here's where this gets very specific to men's health. One of the primary drivers of nocturia, waking repeatedly to urinate, in men over 50 is bladder muscle overactivity combined with reduced antidiuretic hormone efficiency. Magnesium directly calms the detrusor muscle, the smooth muscle of the bladder wall, reducing the urgency signals that wake men unnecessarily in the night. At the same time, adequate hydration from the warm tonic earlier in the evening reduces the compensatory fluid retention that spikes urine production in the early morning hours. Nocturia is one of those problems that sounds minor until it's your life. When you're waking up 2, 3, 4 times a night, shuffling to the bathroom in the dark, lying back down and trying to fall asleep again, it erodes everything: your mood, your relationship, your sense of being in control of your own body. When nighttime urination reduces, men describe it as reclaiming the night. That is not a small thing. Drink your tonic no later than 60 minutes before bed, not immediately before lying down. This gives your bladder time to process it before sleep. Also important, reduce fluid intake after 7 p.m. generally, and avoid caffeine after noon. The tonic works best when it's the last meaningful fluid of your day. Men with a diagnosed enlarged prostate or overactive bladder should discuss this protocol with their urologist before starting. Tart cherries are extraordinarily rich in anthocyanins, the pigments that give them their deep red color. These compounds are among the most potent natural anti-inflammatory agents studied in sports medicine and aging research. During sleep, your body runs its cellular repair and inflammation clearance processes. When anthocyanins are circulating in your system during this window, they inhibit the same inflammatory enzymes, COX-1 and COX-2, that over-the-counter pain medications target. The difference is that they do this without damaging your stomach lining or your kidneys. That morning stiffness, the joints that take 20 minutes to loosen up, the feeling of carrying a weight in your muscles that wasn't there 10 years ago. Men often accept this as an unavoidable feature of aging, but a significant portion of that morning heaviness is driven by inflammatory compounds that accumulated while you were supposed to be recovering overnight. When recovery actually happens, when inflammation is addressed during sleep, men describe waking up feeling lighter, more ready, more like themselves. The anti-inflammatory effect of tart cherry is dose-dependent and cumulative. Drinking it nightly is significantly more effective than drinking it occasionally. For men with joint pain, arthritis, or post-exercise soreness, consider also taking 1 to 2 grams of omega-3 fatty acids with your evening meal. The combination of anthocyanins overnight and omega-3s during the day creates a powerful, sustained anti-inflammatory environment. Robert was one example, but Robert's neighbor, Robert actually sent him to me, was Robert's golfing partner Robert, 72. Different man, similar story in some ways. Franklin, 72, had been waking up every morning with such significant knee and lower back stiffness that his first 30 minutes out of bed were genuinely painful. He'd been managing it with ibuprofen for 2 years, which was starting to affect his kidney markers. I introduced him to the nightly tonic, specifically for the anti-inflammatory properties of the tart cherry, and asked him to give it 6 weeks. At the 6-week mark, he came in for a follow-up and said, "I threw the ibuprofen away. I don't need it in the morning anymore." His kidney markers normalized, and he shot his best round of golf in 4 years. Small change, real results. Here's the benefit that surprises men most, and it's the one most doctors never connect to bedtime nutrition. The majority of your daily testosterone is produced during slow-wave sleep, specifically during the 3rd and 4th stages of the sleep cycle, which occur primarily in the first half of the night. Magnesium is a direct cofactor in the enzymatic pathway that produces testosterone in the Leydig cells of the testes. Studies published in journals including Biological Trace Element Research have found that magnesium supplementation in men who are deficient leads to statistically significant increases in both free and total testosterone, particularly in men who also exercise regularly. When you drink this tonic before sleep and reach deeper sleep stages more reliably, you are literally creating the hormonal conditions your body needs to produce more of its own testosterone, naturally, every night. Testosterone isn't just about the bedroom, though it absolutely matters there. It's about the feeling of being alive in your body, the drive to pursue things, the baseline energy that makes you want to get up and do something rather than just endure the day. When testosterone is low, men often don't recognize it for what it is. They think they've just gotten old. They think they've lost their edge. They haven't. In many cases, they've simply lost sleep. To maximize the testosterone supportive effect of this tonic, combine it with 2 additional habits. First, avoid alcohol within 3 hours of sleep. Alcohol severely suppresses slow-wave sleep and directly inhibits testosterone production overnight. Second, keep your bedroom cool, between 65 and 68 degrees Fahrenheit, as testicular temperature directly affects testosterone synthesis. The tonic does its job best when your sleep environment supports the deep sleep stages where the work actually happens. GABA, gamma-aminobutyric acid, is the primary inhibitory neurotransmitter in your brain. It's the chemical signal that tells your nervous system to quiet down, disengage from the day's stimulation, and prepare for sleep. Magnesium is essential for the proper function of GABA receptors. Without adequate magnesium, GABA receptors become less sensitive, meaning your brain receives less of the calming signal it needs to transition into sleep. This is a major reason why magnesium-deficient men lie in bed with their minds still running, even when their bodies are exhausted. The off switch is there. It just needs the right input to work. The racing mind at bedtime is one of the most common complaints I hear from men over 50. The replaying of conversations, the planning, the worry, the inability to simply let the day go. Many men have resigned themselves to this as just how their brain works now. But in a significant number of cases, it is a physiological problem with a physiological solution. When GABA signaling is restored through adequate magnesium, men describe the experience as the mental noise simply fading and sleep arriving. For men specifically struggling with nighttime mental activity, consider adding L-theanine, 100 to 200 milligrams, to your tonic alongside the magnesium glycinate. L-theanine is an amino acid found in green tea that enhances GABA activity and promotes alpha brainwave states associated with calm wakefulness transitioning into sleep. Together, magnesium and L-theanine create a synergistic GABA-supporting effect without sedation or dependence. Marcus, 64, a retired attorney, came to me for a completely different reason: urinary frequency. But in taking his full history, I discovered that he hadn't slept more than 4.5 hours consecutively in over 2 years. He described his bedtime as, "I lie down and my brain opens a new tab." He'd tried prescription sleep aids, hated how they made him feel the next morning, and stopped. I started him on the tonic, specifically the magnesium glycinate and L-theanine combination, and asked him to stop all screens 60 minutes before bed. In 10 days, he texted my office, which patients are not supposed to do, but I understood the excitement, and said, "I slept 5.5 hours straight. I don't remember the last time that happened." 3 weeks later, the nocturia had also improved. His daytime focus was sharper, and he told me he felt like the noise has been turned down. That's what restoring GABA signaling feels like. A pinch of sea salt and, if you eat a banana or avocado with dinner, adequate potassium together maintain the electrolyte balance that regulates your body's fluid distribution overnight. When sodium and potassium are out of balance, your kidneys compensate by increasing urine production in the early morning hours, a phenomenon that drives that frustrating 3 to 4 a.m. awakening that many men experience. A small amount of sea salt in your bedtime tonic helps signal the kidneys to slow this nocturnal urine spike. It also maintains blood pressure stability during the overnight dip that naturally occurs in healthy sleepers. The 3 a.m. wake-up has a particular cruelty to it. You've done everything right. You went to bed at a reasonable hour, you fell asleep, and then 2/3 of the way through the night, something snaps you awake and you cannot return. It's demoralizing. It makes the whole night feel wasted. When you understand that it often has a specific physiological cause, electrolyte-driven kidney signaling, and that a pinch of sea salt can meaningfully reduce it, you realize you're not powerless. You have control over this. Add a very small pinch, 1/8 of a teaspoon at most, of high-quality sea salt or Himalayan pink salt to your tonic. This is enough to support kidney signaling without meaningfully affecting your sodium intake. If you have hypertension or are on a medically prescribed low-sodium diet, skip this addition and discuss with your physician. For most healthy men, this tiny addition makes a surprising difference in early morning awakening frequency within 1 to 2 weeks. Gentlemen, here is your simple protocol. Starting tonight. Step 1. 30 to 45 minutes before bed, warm 4 to 8 ounces of 100% unsweetened tart cherry juice, Montmorency variety. Warm it, don't boil it. Step 2. Stir in 200 to 400 milligrams of magnesium glycinate powder. Start at 200 milligrams for the first week. You can add 100 to 200 milligrams of L-theanine if sleep anxiety or racing thoughts are a particular issue for you. Step 3. Add a very small pinch of sea salt. Optionally, a small squeeze of lemon for taste and alkalinity. Step 4. Drink it. Put your phone down, dim the lights, give your nervous system the signal that the day is over. Do this consistently for 2 weeks before evaluating. Most men notice improved sleep depth in the first week. Reduced nighttime urination typically improves in 1 to 2 weeks. Testosterone-related energy and performance shifts take 4 to 6 weeks of consistent, deeper sleep to fully express. Be patient. Be consistent. Your body will respond. Before I let you go tonight, I want to say something directly. If you've been frustrated, if you've been quietly embarrassed about your energy, your sleep, your performance, your mood, if you've started to believe that this is just what getting older feels like and there's nothing to be done about it, I want you to hear me clearly. You are not broken. Your body has not given up on you. It is asking for something it isn't getting right now. And when you give it what it needs, it will respond. I have watched this happen hundreds of times, even after 60, even after 70. Your biology is still listening. Your body still knows how to recover, how to restore, how to perform when it is given the right conditions during sleep. The night is not lost time. It is when everything that matters gets rebuilt. Tonight, you can make it count. It is never too late to begin. If this video gave you something useful, a new perspective, a simple step, a reason to feel hopeful, please give it a like. It costs you nothing, and it helps other men find this information when they need it. Leave a comment below and tell me, which of these 7 benefits surprised you the most? I read every single comment, and I would genuinely love to know. Share this video with a man in your life who is struggling with sleep or energy or performance and doesn't know where to start. You might be the reason he takes his first step back toward feeling like himself. And if you haven't subscribed yet, please do. I share new, science-backed health content for men over 50 every single week. Hit the bell so you never miss it. The next video is already one you don't want to skip. I'm Dr. Amanda, reminding you that after 50, vitality isn't lost. It is simply waiting for you to give your body the conditions it needs to restore it. Take care of yourself tonight, gentlemen, and I'll see you in the next one.